Hi, I'm Dr. Jim Hoven of Ramos Law and your host of Health Matters. Today I want to share information with you about one of the most common causes of knee pain that there is. It's patellar tendonitis. So stay tuned, we're going to talk about it right now. In the knee, one of the most common causes of pain comes from what we call patellar tendonitis. Now, if you've watched other videos, you may remember that the term itis, I-T-I-S, attached to anything means inflammation of that thing. So when we talk about patellar tendonitis, that means inflammation of the patella tendon. What is the patella tendon? The patella is the kneecap, or the bone that covers right on top of your leg bone and your shin bone. So that kneecap, it travels, it moves around. It's also, this is an interesting fact, it's the largest what's called sesamoid bone in the body, where a sesamoid bone is, it's kind of a free-floating bone. This is supposed to be there, and what it does is it has this cool function of attaching the quadricep muscles to it, and then it runs over the patella, and then it attaches onto your shin bone or your tibia. And so what that does is it allows proper movement and guidance of motion when you're walking, running, jumping, that kind of thing. Well, oftentimes with patellar tendonitis, it happens if we have an imbalance of strength from front to back of the leg muscles or even side to side in the leg muscles. If we get too much internal strength, in other words, the inner thigh muscles are too strong compared to the outer thigh muscles, or too developed, or they overwork compared to the other side, that can cause irritation to that patellar tendon, which then causes knee pain. And if left long enough, it can do one of the conditions that we talked about in a previous video, CHONDROMALACIA patella, which is where the back or backside of that kneecap gets eroded from improper movement. So taking care of your patella tendon is a big deal. And how do you do that? Number one, make sure that you're getting strength and flexibility in good measure on both the front and the back side of the legs. So we want to be making sure we're doing things like full depth squats, as long as your knees allow for that, or working up to that. Making sure that you're doing things like lifting exercises such as deadlifts that are within your range and your capabilities, not going crazy, but just put the body through a full range of motion. And there's lots of calisthenic type of work that you could do for this as well. But besides strengthening, we also want flexibility. And the flexibility is going to come, believe it or not, in some of these strength moves like full depth squat, we're actually getting flexibility through going to the ground. Also, working on our hamstrings, our glutes, our core, and our quadricep flexibility will help to keep pressure off of that patellar tendon. Now, what to do if you have patellar tendonitis is to see a practitioner, and hopefully this can be a conservative practitioner that knows how to relax or take pressure off of that tendon. It can be done through putting a strap around the patellar tendon itself, which goes below the kneecap. You may have seen this on athletes. You see it a lot on basketball players, the big jumpers, where they have a wrap that goes around that tendon. And what that does is it makes the tendon feel like that's the attachment onto the bone, so that there's less stress going down to the actual attachment, which means less pain. You can also do things like massage to relax the muscles that are involved that are too tight. You can do, again, we talked about active and passive flexibility training. You can do things like acupuncture. And if that doesn't work over time, then there's injections and other types of procedures that can be done. But if we catch patella tendonitis early, it's basically always being able to be helped conservatively. Oh, by the way, one other thing that can cause the patella to go into a little bit of irritation is if your arches are too flat. So if those arches aren't supporting you, instead they're dropping, that increases the stress to the medial side of the knee, which is then, of course, going to stress your patella. And the medial side is the inside of the knee. That's going to stress the patella tendon. So lots of different things to look at. If you're having chronic knee pain, especially if you've noticed that it's getting worse and it's lasting longer and it's not going away with rest, get into a qualified provider, check to see what that knee is all about, and it just might be patellar tendonitis. So I hope you found this helpful. If so, please share it with someone. It'd mean the world to me if we can get as many people help as possible. If you have a question about it, let me know. You can email me at jim@ramoslaw.com, and I'll be happy to help you in any way that I can. And always know that to us at Ramos Law, your health matters.